Much for being here. This is a fantastic day for all of us, and we're so excited that everybody's here to share it with us. It's really special. So I've been doing a lot of talks at meetings and stuff, and they're all virtual for the last 2.5 years, so you have to put up with the fact that I haven't done speaking in front of actual people in quite a while. So I'll do the best I can, but I wrote things down so that I wouldn't miss thanking any of the people that are here. So unfortunately, colon cancer is the second leading cause of cancer death in the United States. If you're a non-smoker, it's the first. So a lot of people don't realize that, not even most doctors. So what we're doing here is extremely important. The risk of colon cancer, of being diagnosed with it, continues to increase, especially in younger age groups. The lifetime risk of being diagnosed with colon cancer is now a staggering 1 in 23 for women. It's 1 in 25 for men. The lifetime risk of dying from colon cancer is 1 in 57. The good thing is that colon cancer is highly preventable, but that's only if you can afford to get the test done. It takes, with extremely high quality colonoscopies, it's possible to lower the risk of being diagnosed with colon cancer by about 80%, of dying from colon cancer by over 90%. So it's highly preventable, but unfortunately the average cost of a colonoscopy in the United States right now is about $3,000. In some places it's much more. That does not include pathology fees. It doesn't include the fees for anesthesia, so it can be much, much more than that on top of an already expensive procedure. The COVID epidemic has decreased screening rates. It's increased the rates of delayed cancer diagnosis and amplified racial and socioeconomic inequities in healthcare. Locally, we also lost our program, Project Special Care, that had provided for more than 4,000 low-price colonoscopies for low-income, uninsured patients over the last 15 plus years. Prior to COVID and the loss of Project Special Care, we had pending referrals for colonoscopies that numbered in the dozens. We now have over 1,400. This was compounded by a lowering of the recommended screening age for colon cancer from 50 to 45. That increased the number of patients that we needed to screen by almost 10%. It was a local crisis, and I don't think that's an understatement to call it a crisis, that inspired the idea for Salud to have its own endoscopy suite. This project started over 2.5 years ago. It has been a long and complicated path, but we've managed to achieve something very significant and something very special. Something that has the potential to save lives and help address significant inequities in healthcare in our community. There are many people and organizations that I want to thank, since without them, this suite would never have been possible. I want to thank Salud's administration, John Sandus, Stephen, Tillman Farley specifically. This is not only a big, but a cutting edge project. We believe that we are only the third federally qualified health center in the country to have an endoscopy suite within the clinic. That's with almost 1,400 community health centers in the country. We also will be a much higher volume facility than the others. This is a project that required significant vision and significant time, something not easily done during a once-in-a-lifetime pandemic. Our clinic manager, Linda Deeming, has been a fantastic partner on this journey and an incredible help. This project would not be here today without her. I want to thank the Joseph Russo Foundation. Their donations of over $250,000 in equipment, all of the equipment that was necessary to start this suite, provided the initial momentum that guaranteed that this project would be successful. Without their extreme generosity, I don't think we would be here today. There were just too many competing priorities with COVID. Thank you, Jean, for being here. Significant donations from the Longmont United Hospital Foundation, my parents, and employee giving through Salud's Butt Savers Club funded the entire renovation project. What an amazing thing it is to work for an organization where the mission truly inspires everyone who works here. We now have not only a procedure room with scope cleaning room, but 3 pre and post-procedure rooms, allowing us enough space for significant initial volume and to expand if we need to. We are super excited to be able to give you a tour of our new suite today, a tour funded entirely on donations. I would also like to thank the Denver Broncos Foundation, the American Cancer Society, the Colorado Cancer Coalition, the United Church of Christ Longmont, and the Longmont United Hospital medical staff for significant donations to Salud's Butt Savers Clubs to discount the cost of initial procedures and colonoscopy preps. I would also like to thank the Colorado Colorectal Screening Program for their longstanding and continued support of our patient navigation program. This is integral to what we do here. Our goal is to perform 200 colonoscopies by July 1st of 2023, and then at least 500 procedures per year. This will be invaluable for patients from Longmont and from throughout the Salud system, from Fort Collins to Sterling, from Estes Park to Aurora, and even from Trinidad and all of the rural areas in between. This is a project with real scope. We're hopeful that we will be likely saving at least 8 or more lives each year. The suite will also serve as a training site for family medicine residents in CU's rural training track. We've already graduated our first resident who started performing colonoscopies in rural Nebraska in September. We are hopeful that our model may serve as a blueprint for other community health centers throughout the country and potentially even another endoscopy suite in Aurora. The need for these suites is overwhelming and it only continues to increase. I would like to say something about Salud's Butt Savers Club. It is more than just a catchy name. It's a really catchy name. We're going to have some really awesome t-shirts this year for Colon Cancer Awareness Month. Butt Savers is the fund that allows for Salud to provide $100 colonoscopies. This includes pathology fees as well for those patients who are at 40% of federal poverty or below, and just over $200 for those just below 133%. All patients receive procedures at cost or below. Donations to Butt Savers will make this program sustainable. We have handouts for how to give to the program, and there's actually a drop-down menu that's on the Colorado Gives website. If you go to the Salud link, there's a drop-down from there. That ends on December 6th. For us, the real work starts now, and we can't wait to get started. Procedures are starting for us on Tuesday of just this next week. Thank you so much to everyone who has made our new endoscopy suite possible. Thank you for coming here today to celebrate with us. We are extremely grateful. It is my pleasure to get to introduce Raya Palugi, our new nurse manager for our endoscopy suite. During a time of extreme shortages throughout the healthcare system, we've been fortunate to assemble an outstanding team that is both incredibly mission-driven and experienced. So thank you, Raya, for introducing us.